All right, hello everyone. I hope you're doing well, and let's get started. This week we're talking about drugs that affect that most mysterious and important of systems, the endocrine system. So to begin, there's a few acronyms I've used. I've kind of tried to let you in on how my brain works when um, I'm in private practice. So I thought you might find it interesting. There's certain acronyms that I'll be using in the first part, and you'll see some of them later on too. So just take a look at these real quick. You may see these. These are pretty common. These are not just something I made up. These are pretty common acronyms: Hyper T4, ARF, that you'll see in medical records at practices. So you'll see them in this first part. So let's begin by meeting Bugsy. And Bugsy is just coming to your clinic for a tech appointment. He's due, the owner got a email that he's due for his rabies and his FERCP. It's been 3 years. So she came in. And while there, you notice he's just kind of a little bit skinny and just kind of a very kind of jumpy, active cat. He's very friendly, very affectionate, but just seems a little wired. And you obtain his weight, and you notice that he's lost some weight. You guys had seen him last maybe about a year ago, and he's lost some weight. And you get his temperature, and his pulse, and his respiration, and you notice that his heart rate is 240 beats a minute. Normal would be like 160, and he's 240. So you say, I noticed he's lost a little weight, and he's got a really high heart rate. Oh, and you notice he has a heart murmur too. There's several things you notice. Okay, but you tell the owner, why don't we get the vet to take a look at him? So the owner does. And so my point here is that a tech appointment is never just a tech appointment. A tech appointment could save a patient's life. If we catch something early, especially, it can make a world of difference for outcomes. Oh, sorry. Yeah. So So what are some things we might want to ask Bugsy's owner? Well, there's the usual things you might ask. Is he indoor, outdoor? Um, you know, how's he been? Anything unusual going on? Is he current on a flea prevention, tick prevention? If he needs tick prevention. And so we ask some of these questions. We find out he's on Revolution. He will be current on his rabies and FERCP. Maybe you already gave it. He's indoor only, no change in diet. He eats a commercial dry food. The owner noticed, he's urinated on the carpet a few times. He yowls at night. Seems just more active. He vomits occasionally. Drinks and pees more. Just looks a little more scruffy to the owner, but she never really thought he was sick. I mean, his appetite is great. I do my exam, and we note that he's lost about 2 pounds in 12 months. His heart rate's very fast. His respiratory rate's pretty fast. His mucous membranes are pink. Capillary refill time, less than 2 seconds. I'll kind of go over this pretty quickly. Thyroid slip, that refers to part of any physical exam. We take our fingers and we just run them down the cat's trachea, and you feel this a little blip, just a little. It'll feel like a little sesame seed. We'll talk more about that later, but you're feeling something in the neck there where the thyroid gland is. He's got a grade 3 systolic murmur. Kidneys are a little smaller than normal. He's a little unkempt. Otherwise, everything else is normal. So And remember, we're going through the SOAP. SOAPs stands for S for subjective, O for objective, A for assessment, and P for plan. You learned, most of you learned last semester with Miss Brittany Strong. So assessment is where the veterinarian is going to list his or her problems. And so these are just some of them. There's the inappropriate urination, the weight loss, vocalizing, heart murmur. Now, even though it's my job to diagnose a problem, what are your rule outs for these problems? Why is it important for you to also think about, well, what could cause your inappropriate urination? What could cause, weight loss with increased appetite? Think about why you think you should have your own list, and we can talk about that later. The some of my own list for inappropriate urination, I break it down into there's behavioral causes and medical causes. Behavioral causes would be there's something they don't like about the litter box. Maybe it's dirty. Maybe it's by a noisy, scary washing machine. Maybe maybe it's substrate preference, which means I found something I like better. Maybe there's cats I can see out the window and I'm feeling all territorial, so I'm actually marking and not urinating. And there's medical reasons: a urinary tract infection, diabetes mellitus, hyperthyroidism, chronic renal failure, acute renal failure, some sort of a liver problem. Right? Those are my, a partial list of different causes for that one thing. And then I go through each of my problems, things that could cause weight loss with increased appetite. There's diabetes, hyperthyroidism, again, gastrointestinal disease like parasites. EPI stands for exocrine pancreatic insufficiency. Vocalizing at night could be behavioral versus medical, versus just a normal kind of aging change. Medical reasons, it could be dementia, hyperthyroidism. You notice that keeps showing up list after, or in problem after problem. Heart murmur could be caused by HCM, stands for hypertrophic cardiomyopathy. Anemia could cause a heart murmur. Sometimes cats are just so excited that you hear a murmur even though there is no murmur. Polyuria, polydipsia could be from a urinary tract infection, diabetes mellitus, again, chronic renal failure or acute renal failure, hyperthyroidism, again, showing up here. And so this is why I think it's important for you to also think of potential problems. For one, it gets the nursing wheels turning, right? Everybody is responsible for nursing care. And as we start to think about, well, gosh, the patient could have this or this or this or this, and then what are some possible ways that's going to affect them, and what can I do about it? You may think of things right there. We don't actually have a diagnosis yet, but it gets your mind thinking about, is this something that's potentially zoonotic? Is this something potentially contagious? Is this something where we may need to recommend a particular food? Am I going to be needing to do an ultrasound or place a catheter? You just start thinking ahead, anticipating what may be needed, because that could save several minutes. If you start getting things ready, every little minute we save is time we can spend with clients or with patients or just getting home on time. So, and I think it's also interesting, sometimes you'll think of a differential that the veterinarian just overlooked. I've known that to happen. I've heard former students say, yeah, I recommended, did they consider such and like, or they would, in a very nice way, they would say things like to the veterinarian, like, oh, and would you like to run a thyroid panel? And the veterinarian says, oh, thank goodness, I totally forgot about that. Yes, thank you for reminding me. You got to find a tactful way to prompt the veterinarian's memory. But these are some reasons why it's helpful for you to also be aware of the different causes. So back to Bugsy. So we run, a CBC, a chemistry panel, a urinalysis, um, 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 and radiographs. And actually, the main abnormality is this thing called T4 is elevated. And so we have our diagnosis of hyperthyroidism, and we will come back to that a little later. Today, we're talking about drugs that affect the endocrine system, and that includes drugs that affect the reproductive system, because the reproductive system is just part of the endocrine system. Our goals are going to be to describe the general function of the endocrine system, the role of the master gland, i.e. the pituitary gland, its two lobes, and the difference between endocrine and exocrine glands. We'll apply concepts of negative feedback and general endocrine control to all endocrine systems. I'll go through this kind of quickly, describing thyroid function and disease, the mechanisms of the drugs used to treat thyroid disease, kind of do something similar for diseases of the pancreas, in particular diabetes mellitus, describing how insulin's produced, what it does, and what the clinical signs of diabetes mellitus are. In other words, insufficient or ineffective insulin. We'll describe types of insulin, other drugs used to control the different kinds of diabetes. We'll describe corticosteroids. In particular, we mean cortisol and aldosterone, how that function is controlled, how hypo or hyperadrenocorticism can alter the physiology of your patient, like this guy right here, and how drugs can restore balance to the hormonal system. And then finally, we'll describe the reproductive side of things, by which the mechanism by which the normal estrous cycle occurs, what hormonal changes maintain pregnancy, which hormones inhibit the release of other hormones. We'll describe how we actually use certain drugs to intervene for certain problems, and then we'll describe certain precautions and threats to humans in handling these drugs. And we're only talking about a few of many endocrine disorders. There are many other endocrine disorders that we will not talk about. For example, this gentleman here, Andre the Giant, who played Fezzik in, wait, did he play Fezzik? Now I'm confused. Anyway, he was in The Princess Bride, and he actually has an endocrine disorder involving a hormone called growth hormone, and animals actually get the same problem. Diabetes insipidus, also known as water diabetes, totally different from the diabetes that we'll be talking about. Reptiles who are fed a low calcium diet by mistake, they can develop an endocrine disorder of the parathyroid gland. Again, we're not talking about that today, but just to let you know, there are lots of other disorders. This is a helpful video. We're not going to watch it, but if you just want another, it's kind of fun, another video about hormones, it'll kind of give you an overview. If you did not watch the video on the Start Here page, you really should stop right now and watch the videos on the Start Here page. I think that was the main one. But if you want to see another one, this one's a little more, just a little more fun, I guess. But we won't watch it. Okay. So the endocrine system is a kind of a weird system. It's not like your cardiovascular system or your nervous system. These are all kind of lonely, isolated organs. They're not connected in any way. They have to use the circulatory system in order to communicate with each other or with other parts of the body. That's kind of an odd system. You might recognize some of these glands, right? There's the pituitary gland, the thyroid gland, the thymus, the adrenal gland. we're mostly today going to be talking about the thyroid gland, the adrenal glands, the ovaries, and also about the pituitary gland. They do so many things, not just growth and development, but your metabolic rate, reproductive function, the stress, glucose, blood sugar levels. There's just so many things they do. They and there we can think of the endocrine system as one of the two great communicators in your body. Um, just like we've got cell phones and email to communicate, your body has these two systems. The nervous system we've learned about lightning fast, traveling down these neurons, but the effects are pretty short-lived. Um, um, the they'll make your heart say beat faster for a little bit and then it stops. They use these little messengers called neurotransmitters, which travel about just a very, very short distance. The endocrine system uses a chemical called hormones. They last a long time in the blood. They can last hours or weeks in the blood. They are kind of slow. They're slower, but they're more long lasting in the effects that they have. And these two systems are not isolated. They work together all the time um, with, um, with, with humans or a cat or any mother. When they hear their baby crying, they will often start to produce milk, right? The hearing the baby crying is the nervous system, but then oxytocin and which is a hormone, gets released to 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 help stimulate what's called milk letdown. So these are not isolated systems. And we're going to keep coming back to the pituitary gland. A couple of the disorders we'll learn about can actually be caused by a tumor on the pituitary gland. Well, one disease, but we'll also see just how it helps control other things. So right here, there's this little part of your endocrine system. It's about the size of a pea, somewhere in here, and just above it is another part. It's part of the brain. It's also kind of part of the endocrine system. It's called the hypothalamus, and it communicates to the pituitary gland, and the pituitary gland communicates to almost every part of the body. That's one reason why it's considered the master gland. It produces growth hormone that stimulates muscle and bone development. It creates prolactin, which stimulates milk production. What we care about today are some of these hormones. It creates a hormone that stimulates the adrenal gland. It makes a hormone that stimulates the thyroid gland. It makes two hormones that stimulate the ovaries. And it also makes a hormone that can stimulate contractions in the uterus. So you'll see these get mentioned again. This ACTH, which stimulates the adrenal gland, TSH, which stimulates the thyroid gland, FSH and LH, which stimulate the ovary. And again, sort of acting like the conductor of an orchestra, stimulating a little bit of the thyroid here, maybe reducing stimulation on the adrenals there, just kind of orchestrating everything. And finally, you'll hear this word endocrine and you'll hear the word exocrine. Exocrine just refers to some sort of a chemical that gets secreted through a duct. So salivary glands, sweat glands, those are all considered exocrine glands. You've got glands, your pancreas squirts enzymes to help digest food. And you'll learn more about that next week. But endocrine means that the product, the hormone, is just secreted without any duct. It just gets secreted into the bloodstream. And this word hormone is a very broad term. And this just shows you here's some sort of a gland making a hormone. It goes into the circulatory system. And then it's going to find a target cell, whatever cell it's supposed to find. And that cell has a receptor. So this word hormone is a very broad term. There are very different things that are all hormones, but they are not alike. Steroids, peptides, enzymes, they're all hormones. They are like enzymes, I think, are quite huge. Steroids are quite small. Peptides are pretty huge, and they're all hormones. And when they stimulate to a receptor, they do something, right? They're going to stimulate a receptor just like we learned about drugs stimulating receptors. You learned about how there's the mu agonists, right? The opioids that stimulate the mu receptor or the kappa receptor. And you learned about alpha 1 or alpha 2 agonists and beta 2 antagonists, right? So hormones are all agonists to some sort of receptor. The receptor can be inside the target cell. It can be outside the target cell. There actually are times where they don't block each other, but some hormones like cortisol and progesterone can interfere with other hormones. And as we talk about each of these systems, there's a phrase, a sentence that I was taught in veterinary school that has really, it's helped to keep me humble. And so the phrase was, the dumbest pancreas is smarter than us. The dumbest pancreas is smarter than us. That was the expression I heard. And what the teacher was trying to communicate to us is that when we'll use the pancreas as an example. When we say, okay, this patient has diabetes mellitus, that's a problem with the pancreas. The patient has diabetes mellitus, well, we're going to start having the owner give insulin. Well, we are assuming the role of the pancreas at that point. We are saying the pancreas, take a break, we'll take over. We are getting in the driver's seat where the pancreas normally sat. Just remember, the dumbest pancreas is smarter than us. And what I mean is, when the pancreas is sick, absolutely, we have to step in. But we can do a lot of damage, right? Insulin, some of the drugs that we're talking about today, if we overdose a patient, we could kill them. So these are really pretty serious drugs. Not all, some of them are extremely safe, but insulin, you could definitely kill a patient with that. And so the dumbest adrenal glands are smarter than us. The dumbest thyroid gland, smarter than us. Okay. Another concept that you'll find helpful is this idea of negative feedback. It's really helpful to understand some of the tests that we do. We're not going to talk a lot about tests today, but the thermostat in your home uses negative feedback, right? You've got this thermostat. It has some sort of a built-in temperature. You've got a furnace, and then of course you've got the actual heat in your house. So when you set your thermostat to a particular temperature, I don't even know what 20 degrees is, but let's say it's pretty warm. When you do that, the house starts to heat up. But how does it know to stop at 20 degrees Celsius? At 20 degrees Celsius, why doesn't it just get warmer and warmer and hotter and hotter? The reason is negative feedback. Once the temperature reaches this point, then it tells the heater to turn off. And then as the temperature drops, the thermostat detects that the temperature is dropping and it turns back on. It stimulates the furnace or the heater to turn back on again. and so on. And you'll see this negative feedback shows up in thyroid hormone. That's where we'll mostly talk about it, but it actually shows up in other systems, in other endocrine hormones too. Okay, so speaking of thyroid, let's begin with our first disorder, the two different thyroid diseases and the drug therapy. So this little cat is kind of like Bugsy, all right? This cat, you know, very skinny, a little crazy looking. That guy looks pretty nervous, right? Just kind of a skinny, agitated little cat. Not mean, but just very wired. And if you could listen to his heart, it is super fast. He's got a little, you can hear a little murmur. And this dog is the opposite. This dog has hypothyroidism. So we'll talk about him too. But first, let's talk about the actual thyroid hormones. Let's stand up here. So these regulate your what's called your basal metabolic rate of all the cells in your body, right? They're the rate at which cellular functions occur. The rate at which you burn nutrients, it allows you to generate heat, the rate at which you metabolize proteins and carbohydrates, and it's even important for just normal growth. The thyroid gland also produces calcitonin, but we're not really talking about that today. We're talking about the part that is what I would call the gas pedal. That's these thyroid hormones T4 and T3. Again, they are like the gas pedal of your body, controlling your metabolic rate. So the thyroid gland, it lives right in here. It's a sort of butterfly-shaped gland. It's somewhere in here. You can't really feel it, but it's there. I promise you. It actually produces two thyroid hormones. One's called T3, and the other's called T4. The number has to do with how many iodine molecules are there. So T3 has 3 iodine molecules. T4 has 4. Just to kind of drive that point home, iodine is essential, right? Your body cannot make T3 or T4 without iodine. And ignore, it says free T4. We'll talk about free T4. So T3 is the hormone that actually does something. It's the biologically active form, but your thyroid gland actually doesn't make very much of it. Now we'll talk more about that in a moment. I just wanted to make a point here about iodine. If you look at your salt in your home, you'll probably notice that it contains what says iodide, but that's referring to iodine. The reason it does that is because iodine is important to your health, and it's possible to, it's an essential nutrient. Before they began adding iodine to salt, some people developed what's called a goiter, and we'll talk about that in a minute, but it was because they didn't have enough iodine in their diet. So anyway, that's why your salt has iodine in it. We'll come back to talking about T4 and T3, but let's bring in these other two hormones. So how does your thyroid gland know to produce T4 and T3? Well, there's two other glands involved. So there's that hypothalamus. It makes a hormone called thyroid releasing hormone, which stimulates the pituitary gland. It stimulates the pituitary gland to release thyroid stimulating hormone. And that will travel through the bloodstream and reach the thyroid gland, where it tells the thyroid gland to release lots of T4 and the little bit of T3 that it has. Well, what prevents T4 and T3 levels from getting really, really high or really, really low? Well, it's negative feedback. Just like we talked about the thermostat and the furnace and the room temperature, the same thing applies here. In this case, the thermostat would actually be your hypothalamus, and your pituitary gland, and the thyroid gland would be like the furnace. And once T3 and T4 levels reach a certain level, that's going to tell the hypothalamus and the pituitary to stop making those stimulating hormones. So again, the T4 and T3 levels are kind of like the room temperature. When they build up, that has a negative effect on these two glands, and they'll say, oh, okay, stop making or stop releasing thyroid releasing hormone and thyroid stimulating hormone. And so the levels can drop. And you'll see this is actually important to help us understand one of the treatments using radioactive iodine. So keep that in mind. Okay, like we said, the thyroid gland primarily makes T4, right? It's not biologically active. And in fact, most of that T4 never leaves the bloodstream. It's bound to these giant proteins, and maybe something like albumin that you've learned about. It's bound to these giant proteins, and it's too big. It can't fit through the walls of the blood vessels, through those cells. There's a small amount of T4 that is not bound. We call that free T4. And that can leave the intravascular space and it can go to a cell. And it's at the cell that it gets one of those iodines chopped off and is now T3. And now it can actually do something to the cell, tell it to make something or generate heat or grow or whatever it's going to tell the, use these carbohydrates, use these proteins, use these fats, right? It's the gas pedal. Okay, so now let's talk about when things go wrong. And we'll start with the dog. Hypothyroidism, you'll probably see only in dogs. You'll never see it in a cat. You might see it in horses and cows too, but primarily it's a middle-aged dog disease. There's different types. There's primary and secondary and tertiary. The main one you'll see is primary. That means the problem is with the thyroid gland. For example, some dogs get, it's called immune-mediated destruction. For some reason, their immune system is slowly attacking their thyroid gland until it's half its size. Secondary, tertiary means there's something wrong with like the pituitary gland or the hypothalamus. We don't care. Those are pretty rare. They're pretty hard to treat. The book mentions goiter. It's not very common, but it's probably worth knowing. So goiter, there's nothing wrong with the thyroid gland. So I'm not even sure if it's not. Yeah, there's nothing wrong with the thyroid gland. Thyroid levels may be low, but because here's what's happening. If you or your patient is not getting enough iodine, the thyroid gland will hypertrophy in an effort to, try to be as efficient as possible, to try to make as much T3 and T4 as possible. As I'm saying this, I'm like, why does it get so big? I'm not really sure why. I've never seen a case of this. It used to be more common in humans before they began adding iodine to our salt, but it can be seen, for example, in animals that are on sandy soil. So a cow or their calf, for example, their diet might be deficient in iodine. So we'll talk about that. I'll show you a picture. But mainly we're talking about hypothyroidism, where there's something wrong with the dog's thyroid gland. And the pathogenesis just refers to the disease process. So how does the disease cause the problems that it causes? So the pathogenesis of hypothyroidism is decreased levels of this gas pedal hormone, and the metabolism is decreased all throughout the body, every different cell, every different system. What are some clinical signs we see? Well, we see dogs that will often be kind of mentally dull. They'll tire out really quickly. They don't want to play. they will sometimes get this kind of sad, tragic expression on their face. It's called like myxedema or something. Their hair coat will look kind of dull and dry. There'll be hair loss, but they're not itching. They're not itching. They've just lost the hair, kind of brittle hair. They'll lose hair on their tail. They'll gain weight. Well, I'll talk about that in a minute. Some dogs just have like a head tilt. It's not a cute head tilt. I mean, there's something wrong head tilt. Some dogs, there's that hair loss, and some dogs will gain weight. But here's the important thing: they gain weight, they do not have a great appetite. If they have a really awesome appetite and they want to eat everything in sight and they're overweight, it's probably not hypothyroidism. And so this is kind of a mean cartoon. It's very mean, but it kind of gets to the heart of the question. Because owners, you know, I've had owners want to test their dog for hypothyroidism, and the dog is clearly not hypothyroid. And I don't really want to waste their money. I'd rather they spend the money on weight loss. So anyway, how is it diagnosed? Blood tests, clinical signs. It can be a little hard to diagnose. Some dogs will have normal thyroid levels, but they're actually hypothyroid. Some dogs, their thyroid levels are low, but they're not hypothyroid. And we'll talk a little more about that next year. But you know, if the thyroid level, once you've diagnosed it, then we can treat it. Sometimes if the owner is hard up on cash and can't run all the different tests to get a definitive diagnosis, some veterinarians will do like a 4-week trial with the drug. The drug is really safe. It's going to be really hard to hurt a dog with this medication. And so it's possible to do a thyroid drug trial, and if there's no improvement with clinical signs in about 4 or 5 weeks, well, then it's probably not. But it's better to do the blood tests. It's better to do the blood tests. And our goals would be to improve some of those signs. Like I'll show you that in just a moment. This is goiter I mentioned, right? So here's a little calf, maybe whose mom doesn't have enough iodine in her diet, so there's not enough iodine in the milk, and so the thyroid gland hypertrophies. And then here's a human with the same problem, and you can just kind of see this big, looks like a big grapefruit under the neck. And I thought you might find this helpful too. These are definitely, all of these diseases today are human diseases too. So humans can have hypothyroidism. And here are all the same things: dry skin, lethargy, apathy. They cannot stand the cold. Cold, even warm weather feels cold. And so if you see animals that just seem to be always heat seeking, that could be a sign of hypothyroidism. Okay, how do we treat it? Well, it's a thyroid supplement. It's a synthetic T4 called levothyroxine. The dog takes it, the T4 reaches the individual cells, and cells can convert it to T3 to meet, you know, whatever specific need they have. There's this other drug, I've never personally seen it used. It's a synthetic T3, liothyronine. I've never seen that before. Far more helpful, far more common is the levothyroxine. It's got a longer half-life, but I guess there are cases where you could still use liothyronine if the levothyroxine didn't help. What kind of adverse effect do you think levothyroxine could have? Well, basically, if the patient were to get too much, let's say we gave them too high a dose, well, they'd probably act like Bugsy. I mean, they'd be hyperactive and maybe losing too much weight and eating everything in sight, right? We basically make them hyperthyroid. So, you know, if we just tell the owner, if they act hyperactive or agitated or anything like that, then let us know. Some things we want to go over with clients, of course, is, you know, they may want to know how long before their pet gets better, right? How long before they go from, you know, all that hair loss and kind of mental dullness to being their old dog again. And in general, it's going to take at least 4 weeks. So it's important that they know that this is not, you know, they're not going to be better in 1 week. It's going to take probably at least 4 weeks for all these changes to take place. There will be rechecks. You know, when we're dealing with hormones, we need to tweak the dose sometimes. We start them at one dose, and then they come back, and we do a blood test, and we check to see if we're in a therapeutic range with our T4 levels. Sometimes we say, well, it's not high enough. We're going to increase the dose and recheck again. And clients, you know, it will help if we can help clients understand that we're not trying to rip them off. We're trying to find the right dose. We don't want to overtreat and we don't want to undertreat. Neither one's good. When we schedule the rechecks, this is the one drug where the blood test has to be done about 6 to 8 hours after the dog got the pill. So we cannot schedule this at 8 o'clock in the morning, right? Unless the dog got the pill at 2 in the morning. So most of these rechecks get scheduled at around 1 or 2, right? If the dog had the pill at 7 a.m., 6 hours later would be about 1 p.m. So clients will be very annoyed if they show up for an appointment and we tell them, oh, shoot, we should have scheduled this at a different time. And like we said, talking about the adverse effects. The other thing is most of these diseases and drugs we're talking about, the drugs are for life. This is not just for a month or two. These are forever. And many clients, very smart people, somehow they won't realize that. You know, I think we assume that they know that, but they don't. And so you tell them later, well, no, he needs to be on this drug for life. They can be a little frustrated that nobody really ever told them that. So we need to make sure that I'll put the words, you know, give 1 tablet by mouth every 12 hours, and then I'll put this medication is for life, just so they understand that. And for example, here's a dog, kind of dull, some hair loss. He doesn't look too bad, but anyway, you can see after 4 weeks now he's all black and shiny again. So it takes a while. Now the opposite problem. This disease is exclusively in cats. Well, I shouldn't say exclusively, but you're probably never going to see it in a dog. You can also call it thyrotoxicosis. Isn't that exciting? But most people are just going to refer to it as hyperthyroidism, generally seen in middle-aged to elderly cats. And here the problem is not the destruction of a gland. There's actually a little tumor growing on the gland, and that tumor is made of thyroid tissue, and it's producing crazy amounts of thyroid hormone. Usually the tumor is not malignant, but it can be. But most of the time it's just a benign tumor, but it's causing big problems. The pathogenesis is the opposite of hypothyroidism. Now we've got, instead of with the dog with hypothyroidism, the foot is not on the gas pedal enough. But here, the pedal is to the metal. The pedal is to the metal. The gas pedal is mashed to the floor, and everything is running at 300 miles an hour. And so that creates a whole different bunch of problems. What are some of the clinical signs we might see? This is kind of a cute little video. We're not going to watch it, but you can watch it. You know, these cats tend to be they're losing weight. They have an amazing appetite. They are, instead of being heat-seeking, they're the opposite. They're kind of cold-seeking. They're going to avoid heat. They don't groom. They're hyperactive. They're yowling in the middle of the night. They tend to have, like we mentioned, some of these. They have tachycardia. They can develop, the hyperthyroidism can cause changes to their heart that we'll talk about in a minute. They can have hypertension. We'll talk about that later. And then there's that little thing I mentioned, the thyroid slip. And let me show you that here. Again, this is where you're checking. There's the trachea, there's the thyroid glands. And again, just imagine right here, a little sesame seed sized tumor. That's what you're feeling. And you will feel it. You'll feel this little sesame seed just kind of blip through your fingers. This video I think is helpful. It's you actually see a cat who's undergoing therapy, and it kind of goes over an overview of everything we're about to talk about. So we'll just watch this.
This is Ringo. He belongs to one of our nurses, Kim, at Vet's Clinic. And he's had a little bit of a problem recently with a condition called hyperthyroidism. So we thought it would be really useful to tell other owners and clients about the condition that occurs mainly in cats, some of the signs that you'd be looking out for, and also what are the options when you find out your cat has this disease. So the first thing that Kim noticed with Ringo, as you can see here, is his appetite was very big. He was always a good eater, but suddenly his appetite had increased. At the same time as this, he'd started to lose weight, and this was a bit of a concern as to why this was going on. The other thing she'd noticed was that his drinking had increased as well, and his activity levels were more than they'd usually been in the past. These raised some alarm bells with us at Vet's Clinic, so we thought the best thing to do would be to take a blood sample from Ringo to check what was going on internally. Now, the only problem with this is that these signs aren't only associated with hyperthyroidism, so we had to give quite a general blood sample first to try and narrow down what was going on. We did find, on taking the blood samples, that Ringo was indeed hyperthyroid, and so his thyroid hormones, the thyroid gland is on either side of the windpipe in cats and dogs and in humans as well, and it was overactive, which meant that we needed to give him some treatment for this. And we needed to look at his ongoing treatment for the rest of his life. So the first thing that we did was we started him on some medication. Now, there's lots of options for treating hyperthyroidism. One is taking some tablets, which is every day for the rest of the cat's life, but the levels must be monitored regularly. So he's been coming in for blood samples every 3 months to check that we've got the right level for him. Other options, if your cat won't take tablets, are surgery to remove the thyroid gland. We've also got food, which you can control, but this wasn't useful in Ringo's case because he's one of many cats in the household, and it would have been very difficult to make sure that he was getting the food and not the other cats. And the last option would be some radiation treatment. That's not something that we currently offer at Vet's Clinic, but it is in specialist centres. I'm very pleased to say that now Ringo's been on treatment, he's doing an awful lot better, but we'll need to continue monitoring to make sure that he's well for the rest of his life and make sure that he's not developing any other conditions. But as you can see, he's now a much happier cat.
Yeah, and so I really like, you saw like that was a really intense way of eating. That was a little more intense than cats usually eat, so. Yeah. And then again, so look, and just remember, they don't always look like this. They might look pretty normal. This cat obviously is pretty advanced, but you know, the cat Ringo, at first glance, he looked pretty normal. And again, just to remind you, these are human problems too, and so this is just from human medicine showing you some of the problems we see: tachycardia, increased blood pressure, Some of these, finger clubbing, I don't know what that is, but in the cat, we mentioned it can cause that condition you learned about last month or so called hypertrophic cardiomyopathy, and that's where the left ventricle hypertrophies, and you get this really thick wall. It's not good. It limits how much blood can go in there, and so these cats can develop heart failure. They can also develop hypertension, so that's high blood pressure. We'll talk about that. And then this is really important. These are usually older cats, and older cats often will also have chronic renal failure. And the problem is, if you have a cat who's hyperthyroid and has chronic renal failure, the blood work will not tell you there's anything wrong with the kidneys. That hyperthyroidism is pumping so much blood through the kidneys that it's making the kidneys look pretty good, even if they're actually terrible. Even if the cat's in renal failure, you may not be able to tell. And so the veterinarian will always keep that in mind, that when they diagnose, when he or she diagnoses hyperthyroidism, that that's not the end of the story. When the patient comes back for a recheck, the veterinarian's probably going to want to do a blood panel again to see if anything's changed with the kidneys. There's that urea and creatinine, those two waste products. In Bugsy's case, he's probably, even though his kidneys felt a little small, he's probably okay because his urine was fairly concentrated. But it's just important to note that when we start to treat the hyperthyroidism, we may suddenly unmask this whole other problem. And again, our goals of treatment are going to be to stop the weight loss, put some weight back on, stop the yowling, basically all of these strange signs, the drinking too much, the peeing too much, all of that we want to take care of. So how do we treat it? There's like the veterinarian said in that video, or she may have been an RVT. There are many different options. So one option is curative, and that's actually using a kind of iodine that's radioactive. It's called I-131. That's one method we'll talk about. You can actually do surgery and just remove the tumor. That's a cure. I think most veterinarians would be a little nervous about doing it because if you take too much, well, you could cause hypothyroidism. But I've known, cats who had that surgery and they did great. There's a drug called methimazole. That's probably the most common treatment. It's not a cure, but we'll talk about that. And then there's diet. There's a diet called YD. We'll talk about that. But the most common is methimazole. So let's start there. This is a pill that can be given. If the owner thinks a pill will be hard to give, it can be made into a flavored liquid, like a chicken flavored liquid. It can even be made into an ointment that we call a transdermal gel. And so the owner just rubs it on the cat's ear, and they don't even have to get it down their throat. It's inexpensive, it's pretty safe, it's well tolerated. Again, this is for life. This is not a cure. What it does is it blocks the tumor's ability to produce T3 and T4. It doesn't block it, it doesn't block normal. The cat needs T3 and T4, so it doesn't block it totally, but it's just blocking it enough that we don't have all these clinical signs. It can cause vomiting, lethargy, and anorexia. That's pretty common for a lot of drugs, but you'll probably see it more often with this drug. you're not going to see it very often, but it's just important to tell the client. In some cases, it can cause a drop in white blood cell numbers. So when they come back for the recheck, we often want to do a CBC to make sure that there's been no changes there. And as I mentioned, it can unmask chronic renal failure. So we'll often also be checking BUN and creatinine and urine at the recheck. So it's good to know about that. Some folks might think, well, gosh, if the hyperthyroidism was masking the kidney failure, well, maybe it's better to leave the hyperthyroidism untreated, and that's not true, because it's the pedal is to the metal. Hyperthyroidism is this excessive metabolism, and it will actually wear out the kidneys. So it's making them look good, but there's a price to pay. It's really wearing them out too quickly. And so we talked about some things you'd want to tell the client. You know, do they want to get it in a gel form? Are they aware it's for life? Again, like the hypothyroid dog, they're going to have to come back for some rechecks, like every 3 months in that video. You know, just to tweak the levels. Do we need to increase the dose? Do we need to decrease the dose? Luckily, the timing doesn't matter. So they can come back at 8 a.m. or 5 p.m. or whenever. This radioactive iodine, the I-131, is generally considered the best treatment. It's very selective for the tumor cells. It will spare the normal thyroid cells. What happens is it's just an injection you give the cat. It can be just a sub-Q injection. It might be other forms, but I've heard of it just as a subcutaneous injection. And then this radioactive iodine gets taken up and it concentrates in the thyroid tumor cells. Now, isn't that interesting? Why does it destroy the tumor but not the healthy tissue? And apparently it's because that thyroid tumor it's not being suppressed by, what's happening is the thyroid levels are so high that thyroid releasing hormone from the hypothalamus and thyroid stimulating hormone from the pituitary, those levels are very low. And so the normal thyroid gland tissue is not receiving any stimulation. Well, so these tumor cells are very, very active. And so those are because they're so active, they're going to take up all of the radioactive iodine and get fried. So that's what's kind of cool about it. And it doesn't penetrate very far, only like a millimeter. And so it doesn't harm normal thyroid tissue. If a client wants to pursue this, it's kind of expensive. I want to say it's probably like $1,000 or $2,000 or more. There is a place up in Chico, I know, that does it, Chico Hospital for Cats. At least they used to do it. There's only a few places in California or in Northern California that do it. But the pet has to stay there for like 3 days or a week, because their urine and their feces will have radioactive iodine in it. It won't actually glow in the dark, but the cat can't go home for a little while, and I think in some cases, even for like a week or so, the owner has to wear like personal protective equipment or something. So I'd have to check on that. It's just important that the owner know that it's not like they're going to go in and then leave that day. The cat will have to stay there for some amount of time. And then the final treatment is, again, palliative. It doesn't cure anything. It's a iodine limited diet. So it's like it's kind of trying to cause goiter in a way. It starves the thyroid tumor of the iodine that it needs. It does not cause goiter. It must have some iodine, just not enough for the tumor. So it sounds great, right? It's just there's no pills, there's no this, there's no that, you just feed them this food. Well, there's some advantages and disadvantages. So you may have noticed in that video, they did not use the diet. You remember why? It's because there was multiple cats in the household, right? The other cats cannot eat this food. They can, but then they need to eat some other non thyroid food. So that's a problem. If the cat who's eating this food, he cannot eat anything else. If he starts munching on another cat's food that's loaded with normal amounts of iodine, then we're just wasting our money. So this might work if a person had one cat and one cat only, and they knew they could control what the cat ate. The other disadvantage is that it doesn't taste very good. A lot of cats get they get bored with it, or they just stop eating it. The other thing is we don't actually know what the long-term effects are. So you'll meet veterinarians who are not that crazy about this food. I love Hills. I think Hills is great. I think they do a great job. So don't get me in trouble with anybody. I think Hills is great, but I have known some veterinarians say, yeah, great idea, but they're just going to stick with methimazole or something like that. A few other things to consider. So something else that happens with hyperthyroid, not therapy so much as the disease itself, involves beta-1 receptors. So do you remember beta-1 receptors? Those are these receptors, right? You've got alpha-1 receptors, alpha-2 receptors, beta-1, beta-2. Beta-1 receptors, those are found on cardiac cells. And all of these, alpha-1, alpha-2, beta-1, beta-2, they respond to fight or flight neurotransmitters and hormones. So beta-1 is on the heart. So what do you think it's going to do when they're stimulated? Well, it's going to increase the heart rate and the strength of the heart contractions. You know, beta-2 receptors are found in airways. So So what happens if a patient is hyperthyroid is they get more and more numbers of these beta-1 receptors on their cardiac cells. Instead of having 10,000, they have 100,000. I don't know. So just imagine yourself, if you suddenly had 10 times as many beta-1 receptors on your heart, when you experience fight or flight, is that going to make your heart more sensitive or less sensitive? Well, it's going to make it more sensitive, isn't it? Bugsy, you can see a little bit of excitement, and his heart rate goes to 240 beats a minute. Can't even clap that fast. So that's not good. That patient's more at risk for having a cardiac arrhythmia, maybe cardiac arrest. So we want to slow down the heart rate. And one way to do that are with drugs you learned about a month or so ago. Does the word beta blocker sound familiar? So we can use beta blockers on a cat like Bugsy. We learned about, in particular, we learned about atenolol. Atenolol is a drug that will block the beta-1 receptors, and then that will, slow down his heart. And then for hypertension, there was a drug we learned about called amlodipine. Amlodipine dilates arteries, including arteries to the heart. So it helps provide blood flow and oxygen to the heart. So those are some drugs that you learned about that would apply to Bugsy. All right, that's the end of part one. I'll create a little Kahoot. So if you wanted to stop and go try the Kahoot, do that. These are very basic questions, all right? This is something we would do as a class and we could talk about, but these are very basic. It's just a starting point for you. All right, so that's part one. come back to part 2.